What's up, everybody? Welcome to the Better You Project, optimizing health, hormones, and aesthetics. And today I have a super special guest. We've gotten the opportunity to share the stage a couple times in the past, and every time that I get to hear him speak, I always learn something new, something just like, that's another way of thinking about it, and I love it. So I've got Dr. Stephen Sorr on the call with us today for our podcast, and he is a naturopathic doctor out of Arizona, and he has a really unique practice, and I kind of is like a unicorn in the aesthetic industry in that he does a great job of marrying aesthetic eye, aesthetic injectables with the regenerative medicine, PRP, and then he does the functional medicine very, very well. So I resonate so much with him because there's not many of us who kind of do all the like levels and then get to like, he nerds out completely. Like that's what I said before we hopped on. I'm like, listen, we're gonna have to rein it back a little bit because this is a podcast really geared. It was geared towards patients, but then what I quickly learned is that there's a lot of healthcare providers who also listen to it, which I think is great. And so, Dr. Sorr here, he is a trainer for Galderma. He speaks, he lectures, he educates. He's very much like myself. And I think that's why I resonate so much with him and his work, because he is the ultimate scholar and he is always going to keep learning. So without further ado, Dr. Sorr, welcome to the podcast. Do you want to say a little bit about your practice and kind of how you got started in naturopathic medicine?
Sure, absolutely. Thank you so much for having me on here, Lexi. I really appreciate it. It's just an honor to be able to speak to your platform and to all of your listeners. So I started my journey a long time ago. It's been 10 years since I even graduated med school. So I started my journey 15 plus years ago. We should just probably not talk about how long I've been in this whole journey. But I started off by getting interested in medicine because of my own back. And I hurt my back when I was 18 years old. I couldn't walk, had sciatica, so I went to a chiropractor. I started doing yoga, kind of got into that. And it was just through this really interesting process, very organic, where I started to learn how to actually take care of my body. My father is a pharmacist, mom and pop pharmacy from New Jersey. My uncle's an eye surgeon. And they said, whatever you do, don't go into healthcare. Stay away from medicine. Just because the insurance companies and just the whole red tape and all that. So I was like, okay, right. Well, I guess I shouldn't be a doctor then. But my brain is wired this way. But I had this really interesting, thing that happened in my life. And it was the worst thing that's ever happened to me. The amount of pain that I've physically been in, I don't ever want to wish that upon my worst enemy. But what I did was I took that and I made that my superpower, not my kryptonite. I learned from it and I continue to do so. So I got into medicine. I was very, very interested in the physical medicine side of things. And while I was in med school, somebody came in and did a little guest lecture on prolotherapy. I had never heard of that. I was like, well, what is this? Well, it's regenerative medicine. We're going back to 2010. This is literally before anyone even heard of
way
therapy.
Ahead of your time. Way ahead of your time.
Mm-hmm. So there was a actual doctor here, Dr. Pomeroy, who I got to shadow with. I was his last intern before he passed away. So I got to see the OG prolotherapy guy doing prolotherapy on his patients. And I was just a little baby med student. I didn't know from anything. So that really inspired me and sparked my interest while I was in school throughout my studies to learn more and more about regenerative medicine. And so that was my primary focus. Yes, I was studying naturopathic medicine and looking at the holistic way of treating people, both with medicine as well as botanicals and lifestyle. I quickly moved into PRP after that, and stem cell, all of the things that are now so ubiquitous. Everybody knows about them now. But when I started, this was completely foreign to so many people. Kim K just had the vampire facial, just. So that's how far we're going. So a lot of time has moved on since then. And I continue to do, orthopedic cases, not as many as I used to, just because my aesthetic practice has taken over so much so, and the reward is so much greater. And I'll tell you why. On the ortho side, people need to put in their own effort. Rewinding the clock and healing the joint can only go so far if the person doesn't fix their functional movement patterns. They got themselves into this mess. So if they're not ready, willing, and able, and coachable and trainable, they're not going to get better. So I tell them, I'm going to unsell you on regenerative medicine because you're not the right candidate mentally or not in the right headspace to do that work.
Right.
And they don't like that answer, but I sleep well at night. They can go down the street. They're like, it only worked for a little bit. Like, of course.
Yeah. So you started out basically integrative medicine, then turned into aesthetics.
Yeah. So I got into aesthetics because of PRP. And I had just started into aesthetics in about 2016. Kind of got my feet wet. And my rep came in from Galderma and showed me Sculptra. This is a long time ago. All right. And I read the studies on it. I'm like, do you know that this is regenerative medicine?
Yeah.
My core principle as a naturopathic doctor is to stimulate the body to heal itself. I'm like, this is so cool.
Yeah.
We don't learn about that in medical school. No one learns about this. I was just enamored and I dove into it. And so I started my practice really with Sculptra and obviously fillers and toxin, things like that. But microneedling, I have lasers, everything that stimulates the body to heal itself. That's my core. And I still do that. And now I speak around the country on it. So
yeah. No, it's awesome. It's awesome. So super valuable background in all the things. And so I think today what I would really like to kind of dig in with you a little bit more, only because I've heard you speak on this, and like I said, you and I have presented before, and I feel like every time I've heard you speak, I'm like, I always learn something new. So really the goal here of this episode is I want to kind of dig into a little bit of testosterone replacement therapy. I feel like this is where aesthetics is going, and that they're trying to get into our world of functional medicine and wellness, which is exciting. It's an exciting time. And I think, the patient base is very similar, right? So let's start off with a little bit of, can you explain what testosterone replacement therapy looks like in a male patient?
Sure, absolutely. So you're absolutely right that the wellness industry is trickling into aesthetics because the people that are investing into their face also want to invest into their body. We're going to look at a certain demographic of people that are wanting to make sure that they're eating clean, they're moving, they're taking care of themselves. They understand the benefit of this. Right. But what happens to all of us as we get older is this hormonal decline. And there are many reasons for this. And sometimes you need to replace that hormone, and it is incredibly effective. You can see many guys at the gym and they're working out, they're doing the same workouts, they're trying and trying and trying, but they're hitting their peak. They cannot get past this. Their gains aren't there. They're not recovering like they used to. They're focusing on diets. I'm sure they have more responsibility as we all get older with, kids and jobs and everything else in life, which that's an actual factor. We can call it stress, but it's a factor. And if you can't work on that lifestyle component, or you're hitting that wall, replace the testosterone if it's low, and get them optimized. We're talking about testosterone replacement therapy, where we're bringing men and women, but we'll talk about men today, into a physiological optimal range. We're not taking them into steroid abuse. We're not even using anything that is an analog to testosterone. We're not doing bro science here. This is physiological range, which we can talk about range.
Yeah.
How unhappy I am with what the range is.
Right. So when we talk about the reference range, right? So you go to the lab, you see your patient, we order a total testosterone, free testosterone, sex hormone binding globulin, PSA, estradiol, all the labs, right? All the things that we think that this patient needs.
Sure.
They get their labs back, right? The reference range, now depending on what lab you're using, the reference range could be, the lowest end is 200 with the highest end at 900 or 1,000. Let's say this 35-year-old male comes in and he's 320. The doctor's going to say, or the traditional doctor is going to say, you're in the normal range. There's nothing wrong with you.
Right.
The 80-year-old guy is also at 320. You mean to tell me that this 35-year-old guy and this 80-year-old guy, they're cool to be the same T? I have a hard time believing that.
It's offensive. It's offensive.
Yeah, it is. Yeah. It is. And unfortunately, this is traditional medicine, right?
I'm going to go with conventional on that. The convention is, it's not really a problem. What's the downside of having low testosterone? Does it impact the health? Well, the studies on it are a little bit mixed, this and that. Yeah. You'll hear that on the naysay side.
Right. Right. So what Dr. Sorr and I are trying to do is we're trying to make the patient in the uppermost quartile for the patient to be in the optimal stage. So when we talk about that, a lot of times when I'm talking to male patients, being a female, I try to be very matter of fact. So I always say the benefits of testosterone can be improvements of things like focus, concentration, vigor, vitality, mood, anxiety, that afternoon slump, recovery time in the gym. We always say muscle is the currency of aging, and I'm in the business of trying to help you age in a better way. I very lastly say libido, only because a lot of times that's the first thing they think about. I'm like, no. There's so many other things that we have to fix. So when you're doing that consult with the patient, what are the key points that you hit on as far as the benefits of TRT beyond libido?
So I always start off my conversation in my own style, and I ask them, do you get morning wood?
Mm-hmm.
That always makes them do a couple of things. One, it's a smirk. Two, it's a, oh yeah. Or three, it's they're looking around the room like it fell down on the floor, like, where did it go? I'm like, yeah. So that might be a little sign of something else is going on. When I do my initial blood work on somebody who's not currently supplementing with testosterone, I look at their pituitary hormones, and I can tell what's happening there. And if there is this screaming and yelling from the brain to make testosterone and it's not happening, the testes have given up. You're not doing anything wrong at that point.
Right.
If your brain is saying, I don't want any testosterone, and it's really, really low, and you feel like you're in the dumps, that's a problem. So is it stress? Perhaps.
Yeah.
I can tell you my story and where my levels have been. I can show you what I looked like 10 years ago, what my hormone levels were 10 years ago, what my diet was like 10 years ago, and exercise was like 10 years ago.
Sure.
I fixed that. I optimized that. And my numbers, thankfully, came back into awesome optimal range.
Yeah. No, I think that's
for everyone.
Right. And I see a lot of healthcare providers, a lot of physicians, and I look at them and I'm like, your lifestyle does not support a good ecosystem for pituitary HPA axis function. You sleep 6 hours a night, your diet is shit, you drink alcohol, you're not working out, like you're not supporting all the other things. And so I know that you, Dr. Sorr, talk with your patients about movement and exercise and nutrition and all those things. So yes, we're going to jump into the testosterone, but we talk about those things as our foundational pillars of health.
It's the onboarding that matters so much with patients, because this is not your traditional or conventional healthcare. We're really dialing people down and getting precise.
Absolutely. Let's talk a little bit about the difference. Let's say, for example, you had a guy come in and, his testosterone's in the 300s and he's in his 30s and he is not sure if he wants to have children, or maybe, they have one, but they're like, they're on the fence if they're going to have another one. Let's shift gears a little bit. Let's talk a little bit of difference between endogenous support of testosterone versus exogenous support of testosterone, because there are many options.
Yeah, there absolutely are. So we don't rush to put somebody on testosterone. In fact, according to your conventional guidelines, you need to have 2 blood measurements, which I think is really practical, and it's reasonable and prudent to do that. Like maybe it was an off day, maybe an off time in your month. Like let's try to do a little dialing in, see if we get some sort of delta on your own. But if we're keep pounding it, and we're not getting anywhere above 500, we're in a hypogonadal state. Okay.
Right.
So I think it's really crucial to say, are you stimulating your androgen receptors? Movement medicine. Are you actually pushing yourself to your brain? Because if you're not, you're not. Sleep is so underreported. People do not focus on their sleep, and it is vital. So if people aren't sleeping, I'm going to focus on sleep. If they're just coming in as like almost like a drug seeking behavior and I want testosterone, how hard am I going to push them on that? Do they qualify for it? Will they feel better? Yes. Do they want to have children? Yes. Okay. If they want to have children, we got to stop. Either go ahead and get a sperm analysis, sperm. Listen, I don't know, but I don't want to take the risk and be like, well, you started and you can't produce sperm. Infertility is a potential hazard. It's a risk with being on exogenous. We could talk about SERMs, obviously. We could talk about ways to increase the pituitary access to increase the testes production.
Right.
But again,
right.
got to do it before and after.
Yeah. Yeah. So I think too, the important thing, and I know that you do this, but like a really good informed consent in that, like in our consent for TRT, we make them initial, like I fully understand that if I choose to replace my testosterone, I run the risk of not being able to conceive, in that if we're replacing it exogenously, whether it be an injection, whether it be a pellet, whether it be a cream, we're kind of telling the testes like, hey, don't worry, we got this. So like y'all can shut down for like a hot second there, and we may not be able to turn that back on. So some other options that I like to offer patients is maybe things like enclomiphene, which can help with increasing the natural, turns the testes back on to stimulate the Leydig cells, increases luteinizing hormone, which then will increase testosterone. The more expensive route is like HCG, which is really hard to get, but it works. And I've been very successful twice, actually, a guy came to me from like a low T center on shots. And I'm like, oh, shit, it's all shut down. And then like we got a semen analysis and combo of HCG with enclomiphene. So it is possible. But just as you said, I think a very good assessment and intake, try some lifestyle things, and be very clear with realistic expectations for the patient. From a dietary perspective, are there like any specific things that you recommend or omission of things that you recommend to help kind of natural boost of testosterone?
So let's just get the soy thing out of the way. There is absolutely nothing wrong with soy. Whoever is on that train needs to go away.
Yeah. Yeah, no, I agree.
Nothing wrong with soy. Soy is a really good form of protein. Mm-hmm. And in that same thought, I like to tell people this in a very humorous but factual way. Boys are stupid, girls are crazy. Just to be fair, you need a little bit of everything, okay? You need estrogen. Men need estrogen. If they don't have estrogen, let's say you want to block estrogen with an anastrozole, they're going to have joint pain, erectile dysfunction. Mm-hmm. They're going to feel flat and depressed. Mm-hmm. Need a little bit of estrogen. Too much, they're going to have nipple sensitivity and other
itchiness.
Yeah. But, I want to back up just a moment and talk about this exogenous delivery of testosterone. Women get exogenous delivery of hormones at puberty. In high school, they're putting on birth control, and that shuts off the HP axis as well.
Right.
And then once you take away that pressure, the body usually comes back. So it's not a permanent thing for most people. It just is a possibility. Mm-hmm. But you need to walk them through that with informed consent. They need to understand what that risk is. You can't say, I never told you.
Right. And I so wish so many times that, GYNs, they gawk at our bioidentical hormones and our creams and our pellets and all those things, but they have no problem putting people on oral birth control pills. And it's like, there are some long-term ramifications that can happen, increasing things like sex hormone binding globulin. The hormone metabolites can happen through first pass, and that they're going through the gut, which then goes through the hepatic system. So there's a lot of things. Yeah, there's a lot of things. And then, listen, I'm just going to start. Shameless plug. So Dr. Sorr and I are actually going to be doing a conference talk together, a workshop at Aesthetic Next in Dallas in September. And these are the like nitty gritty things that he and I are going to nerd out and get into. So if you're a healthcare provider and you're like, how do I learn this? Well, you're not going to learn all of it in a 2-hour block. But if you're interested in kind of dipping your toe into this world, we're going to kind of provide some case studies of actual patients that we've seen. And this is how I would manage it, or this is how I would pivot to get this outcome. So just as like Dr. Sorr is saying, there's lots of other things that we can do to help. But I think the important piece is that oral birth control pills also come with their own slew of issues as well. For sure. Yeah, from a lifestyle modification, I always kind of talk about lifting weights with our patients. And I'm like, I've got 2 lifts that I think are really good if your body allows for it. And that is picking up heavy things and putting them down. So that's going to look like things like deadlifts. And I say deadlifts, again, if your body allows, because with that, your back and your legs are your two strongest muscles. They really, really are. And so by doing that you can recruit androgenic receptors. And so that can help stimulate testosterone. The other one is if your body allows some sort of squat. That can be an air squat. That can be any kind of squat. It doesn't have to be anything heavy. And neither with a deadlift. Like, I would say you can do 2 little kettlebells and just put them on the floor and pick them back up, put them on, and you're working on grip strength. Like a lot of these things when we talk about longevity medicine and building up strength, I think those things are the best things we can do to help people's bodies naturally increase testosterone. And just we said, sleep, recovery, eliminating alcohol. There's so many things that can play into it. What about
bodybuilders will also be very clear on this. If you are bulking, you can bulk. If you are shredding, you're shredding. And men who want to shred down to like 8%, 6%, 3% body fat, their hormones go in the tank. Mm-hmm. So overtraining, overdoing it, and undervaluing your caloric macros, and you're not dialed in there, you're going to have hormonal fluctuations.
Yeah.
Your thyroid can tank as well,
absolutely.
Which I think is important. I know we're talking about testosterone, but thyroid is another.
1,000%. I mean, that could be a whole workshop on its own as well. Yeah. As well. The other thing I will say too is when I do start replacing testosterone, I feel like many of the men are like, I feel amazing in the gym. Like my recovery is better. I feel like my joints don't hurt anymore. And I feel like it's like those little pieces where it's like, well, I'd get to the gym, but I don't have any motivation. And then it's like, well, I don't have any motivation. It's like this vicious cycle. But I feel like when we start truly replacing testosterone, they feel so much better. And so then they start seeing the results. And then when they start seeing the results, now they're hooked, right? Now they're like, all right, I think I got the swing of things here. So I think that can be so important in that you're helping them kind of stay motivated to do these lifestyle changes for the long term, right?
Yeah, one of the benefits actually happens in the mind first. I'll notice the mental changes first before physical, because the body does take time to respond. But yeah. I promise people, I'm like, in the first 6 weeks, you should notice it more in the head before in the body.
Yeah. I will tell you the amount of male patients I've been able to help get off of Lexapro, Prozac, Adderall, many of the antidepressants by just replacing their testosterone, which is incredible, right? It's incredible. All right, shifting gears a little bit. I was like, I'm going to pull a peppering of some kind of controversial information, only because I know Dr. Sorr, like myself, loves to just bust some myths and be like, nope, that's false. That's wrong. So I'm going to talk a little bit about the Traverse trial. So this was a large randomized double-blind placebo trial, which if you're a patient and you're listening, that's like what we call the gold standard of research, right? And so this involved around 5,000 male patients. And I was just talking to him right before we hopped on is like they truly picked the sicker of the bunch of like, if shit's going to go bad, it's going to happen to these guys, right? And so the average age was somewhere between 45 and 80, which is if you're 80 and you're getting TRT, like, there's a lot of controversy with that. And they chose patients who had some pre-existing cardiovascular disease and who were at risk for cardiovascular things. And the crazy thing about this study that kind of came about was, they always say like, testosterone causes prostate cancer, right? And so I always say testosterone to the prostate in traditional or conventional medicine is what they think estrogen causes breast cancer, which it does not. And so what's so interesting is that the results of this study showed that testosterone was actually very beneficial, very, very beneficial, and that it helped reduce the risk of cardiovascular events. It actually showed that it did not increase coagulability, which is blood clots. And so I think so many times we have to have that conversation and say like, listen, I know that there's with any action, there's a reaction. So how do you, Dr. Sorr, explain that to your patients as far as the safety of TRT when it comes to things like the big myths, right? Heart attack, blood clots, prostate cancer.
Great question. So some of the older trials on testosterone were done so poorly. They were giving them a once a month injection, then maybe a twice a month injection. And those still had benefit, but they really didn't show the risk that you're associating with because they never really took them up to a physiological dose that's optimized. And they were taking, again, very sick people. But when we're talking about erythropoiesis, where you're getting this spike of red blood cells, which is a natural thing that testosterone does, when you spike someone very high all at once, you get more of that effect because of the hormonal cascade. If you were to divide your doses and to lower each dose throughout the week, 2-3 times a week, you're going to have a much better, even peak and trough, if you will. We're talking about injection therapy. This is the most common application of TRT, is using an IM or sub-Q injection. It's easy, it's adjustable, you're not stuck with it. It's easy to test and measure and make changes. I love that. So what we've noticed, and you can put someone on a pellet, but it's in there.
Oh yeah.
Like salt mashed potatoes. I can always add, but I can't take away. So I like to be very conservative and get them on a dosage first.
Yeah. So in your practice, because there's lots of ways you can do the injection. Do you mainly do sub-Q, or do you do IM, or do you do both, or does it depend on the patient?
If it's a larger bolus, I will go more IM. If you're doing like something like 0.2 or 0.25, they can handle a sub-Q.
Yeah. I would say in our practice, it's a majority of what we do is we do sub-Q twice a week, around 0.2 to 0.3 milliliters of a 200 milligram per ml vial.
Exactly.
So the best thing that I've actually seen with that is that their levels are very steady. We see a very low risk of rise of sex hormone binding globulin, low risk of aromatization, low risk of erythrocytosis. And so we don't have to have them blood dump. We don't have to do any of the other bullshit they have to do when they're on like a big old dose every 2 weeks.
All the things. We're seeing the same exact thing. You're right on point. Exactly.
Yeah. And you get by with a much smaller dose, which is incredible, right? And we always say, like maximal benefit with the minimal amount of side effects. That's truly the way to go. And so then to your point, the guys, they'll feel great, but they get shot fatigue, which, if you're doing peptides in practice, it's very easy to get shot fatigue. Like, there's plenty of times where I'm like, I need TB4 and I need BPC and I've got this and I've got that. I'm like, oh shit, I'm so tired of sick of myself. But so that's where in our practice, we'll do pellets. And I 1000% agree with you. In our practice, we do about 400 pellets a month. 400. That's a shit pot. That is a lot of pellets. And our men's population's really increased this last year. We hired a men's health nurse practitioner, and it's been awesome. And it's been great. And so I've learned a lot more of the management of men's health piece of it. That's why I was like, I need to get Dr. Sorr on this. And so with that, I think seeing a provider who is going to do the workup like Dr. Sorr and I do, who is going to sit down and explain these things to you and looking at all the moving parts in that, are you a better candidate for injections? Because what happens is if you start getting that shot fatigue, you're going to see the roller coaster effect. And then it's like, you know what? Maybe you're a better candidate for pellets. So I do think that's important.
Best is the medicine that you're going to take.
Yes, 1000%. So because I get this question too, what about like nutraceuticals to help with TRT? Like, have you seen, and I kind of know what your answer is going to be, but they always ask about DHEA. And I'm like, if you really look at the literature, you just don't see it. You just don't see the support in that. So I think that there's that. And I tell patients, I'm like, if you want to try it, you can. I'm not guaranteeing you anything because, like you, I'm very research based, and I'm like, we just don't see the literature on that. What about? We hear about there's like Tonkat Ali. There's other things. Like, have you seen any benefits with the other ones?
So when I'm looking at testosterone, I almost don't even care about your total testosterone. I really just want to see your free testosterone. If your free testosterone is at like 35. And we would like to see you at 135 or 165 or something like that. You got to do something. Right. Okay. I do like Shilajit. I think it's a really wonderful tool. It works very, very well. I've seen that clinically. I'm very happy with that one simple. Just add Shilajit, because what its mechanism is, it's going to kick off your testosterone from sex hormone binding globulin. So anything that's going to curtail what the SHBG is holding on to is going to help boost that free testosterone. I am very concerned as we're increasing free testosterone, what's happening to DHT levels and also estrogen levels. Now, because I live in this hybrid world of aesthetics and wellness, I'm concerned about my hair follicles.
Right.
And
Yeah.
I block my DHT, and my testosterone is even higher than it was the previous year. So it doesn't crash your testosterone, and I feel even better, both mind, like mentally, physically, and also aesthetically too.
Yeah. It's amazing. Yeah. Yeah. No, it's great. No, that's perfect. So I think I'm looking at my notes here. So if someone's looking for a good provider, what should be the things that they're looking for?
Credential your providers. Interview the provider before you go see them. Right. Insurance coverage does not work in this space. I'm sorry. No. You're not going to get it.
No. And it's one of those things that if it's worth the investment, like you're going to feel better. You're going to feel better, and investing your health, I think, is absolutely key. Right.
I'll say that if your provider, and let's say you've credentialed them and you want them and all that, if they're coming at you with a peptide first before testosterone and they don't do the proper workup, they're in it for money out of you. And that's a problem for me. First to no harm includes bank accounts.
Yeah. No,
it's incredibly cheap.
Yeah. Yeah. Oh, absolutely.
Peptides are incredibly expensive.
Yeah.
So why put the cherry on the top if you forgot to put eggs in the cake? It's going to crash.
I love that. I feel the same way when people do GLP-1s without any kind of body composition testing or lab work. I'm like, run the other way. Run the other way, please. Which, again, we get on a whole nother soapbox on that, but we're just going to rein it in. All right. So I think that answers all the questions I had. Again, this was really just a teaser because Dr. Sorr and I, like I said, we're going to be presenting together for the third time at Aesthetic Next in Dallas in September, 2-hour workshop, case studies. I actually am going to be demoing on like a prosthetic butt cheek pellet procedure. So that's going to be really cool to kind of see how I do a female procedure versus a male procedure because the technique is a little bit different. Where can people find you, Dr. Sorr?
Oh, I'm all over. If I'm on Instagram and TikTok, the handle Dr. Steven Sorr, all one word. And I am available also on my website at mysourceofhealth.com.
Perfect. And I will get all those links in the show notes. Thank you so much for joining us on the podcast. I'm so excited to get to present with you again this year. And yeah, I think that's it. Any final thoughts, closing, anything like that?
It's a pleasure as always, Lexi. I could do this all day long. It's just we're so far away, yet we're so like-minded. So I enjoy this every single time, every opportunity we get to speak.
Oh, well, I appreciate it. Thank you so much.
Thanks again for having me.